Hello, my name is Marcia Boyle. I'm the president and founder of the Immune Deficiency Foundation, which is the national patient organization dedicated to improving the diagnosis, treatment, and quality of life of the primary immune deficiency diseases. It's critical for our patients to be diagnosed properly and appropriate treatment initiated. And for appropriate treatment for many of our patients is expensive. And in this day, insurance companies worry about that and try to use some of the typical techniques that they may use with other pharmaceutical products, other disorders. But what happens with our patients is if you, for instance, with immunoglobulin, if you are put through many hoops to prove your diagnosis where you've been on immunoglobulin for years and you have a trail of how it's helped you, but the right tests weren't done 20 years ago because they didn't exist. Take somebody off immunoglobulin to prove they have to be off for like 6 to 9 months. That patient's going to become more and more ill. They're going to have pneumonias. They're going to have lung damage. In the long run, a patient who does not get their therapy is going to be sicker. They're going to be hospitalized more, and their lifespan in terms of being a healthy, productive member of society is going to be shortened. They'll be on disability. So many insurance companies are looking for the short run. They're not looking for the long run. Don't fool around with these patients. Make sure they have access to their products. Thankfully, for those who don't know what severe combined immune deficiency, or SCID, is, if you've heard of David the boy in the bubble, he lacked total immunity. These are babies born with lacking all aspects of their immune system, and after a short period of time can become deathly ill. And many of these patients, by the time they're diagnosed, are too sick to have a bone marrow transplant that can save their lives, or the bone marrow transplant isn't going to be as effective. And so the best way to deal with these patients is through newborn screening. And the Secretary's Advisory Council and the Secretary of HHS did agree that SCID should be added to the national panel. That was great. Then all 50 states then had to decide to add it. Thankfully, we are now at 34 states are currently screening. Maryland, the state I live in, will be screening shortly, the end of the first quarter. And most other states, either by the end of 2016 or in 2017, have plans to screen. There are only about 3 states that we're really concerned with. But this is just one of these decisions that if you screen, you're going to identify these children. They can get treated immediately. There is an effective treatment, and their lives will be saved. It's very exciting. It's also cost effective. When you're talking about newborn screening in some of the states that were a little slower to screen, it's $7 per screen. Well, there are many SCID babies who've been born who've cost the system $1 to $2 million, even $3 million, because they were very ill, trying to keep them alive, trying to, quote, cure them, and have a transplant that didn't go right, etc. For $7, and many states, by the way, with Medicaid, have to pick up half of the costs, can save millions of dollars. So it's kind of penny wise and pound foolish. Well, many people know about electronic medical records. You go to your local physician's office or the local hospital or whatever, and you sign up for your chart or whatever. The problem is, our patients see many different physicians, many different specialists, and unfortunately many of these medical records don't talk to each other. Interoperability is a big problem. We decided to develop our own e-personal health record. This is a situation in which the patient is entering their own information. You can upload your anything that you want to, in terms of your own charts. You can link to Microsoft Health Vault and have your lab results or your prescription information come electronically right into the record, and the patients can comment on a query and research. They can have conversations, and several conversations that patients have been having have been leading to some kind of small clinical research projects. Then I was nominated for, and which I didn't even realize, but then I was chosen to be a champion of change in precision medicine by the White House this last July, which was very exciting, because of PI Connect, our electronic personal health record, and then turning it into precision medicine, bringing the patient to the center of research, what's really happening to the patient. A few years ago, we launched a national walk program, and we were in 9 cities this year, and next year we're going to be in 12 cities. And this is exciting. It's been really embraced by our community, who have a walk in a place like Chicago, New York, Philadelphia. We're going to be starting in Atlanta. We've had Florida, LA, Minneapolis. I'm probably leaving out a little bit, but that patients can all of a sudden, and families can invite their families, their friends to come out and support the organization. Many families perhaps can't give much, but through their connections, they can get other people involved. It raises awareness. It creates a better sense of community. And, it's just been a very positive step for us, not only in fundraising, which is extremely important, but in awareness and community building. I'm wearing a pin that looks like a little bit of zebra, and it's very important to our community. In 2009, we launched a Think Zebra campaign that has gone viral in our community. Now, why did we do that? We find that physicians are taught in medical school to, when they hear hoofbeats, look for horses, look for the most usual diagnosis. Immunologists and other physicians who treat rare diseases are taught, look for a zebra, look for something unusual. And we try very hard to educate physicians. We have several educational materials, and we try to get things out as much as we can, but our community has embraced being zebras. Most people that you speak with have gone through physician after physician after physician, not believing them, not thinking that there's something else going on. The mother is overreacting, whatever it is, and not looking for the underlying condition. So physician awareness, physician education is extremely important, and we tell our physicians that we know to think zebra.